Welcome to Chapter 21, Microbial Diseases of the Skin and Eyes. This chapter fulfills Objective 4, specifically interactions between microbes and their host and microbes in human disease. In this chapter we're going to talk about the structure and function of the skin, some of which we've already covered in previous chapters. We're going to talk about normal microbiota of the skin, microbial diseases of the skin, specifically those caused by bacteria, viruses, and fungi, and microbial diseases of the eye. Let's go over the structure and function of the skin again. First off, there are two main layers of the skin. You have the epidermis, which is composed of keratinized layers of skin. You have the surface of the skin, and you have the openings of the sweat pores and the hair follicle shafts, of which oil glands are associated with. The dermis is where you have blood flow. You've got living cells that are differentiating into keratinized cells. You have the base of your hair follicles and your sweat glands. And down below is your subcutaneous layer, which is mainly adipose tissue, which provides insulation so that you don't lose too much heat to the outside environment. Also provides flexibility of the skin. Now remember that from a microbial point of view, the function of the skin is to provide a barrier to the outside world so that you don't have microbes coming in and getting inside of your body. It also is your main organ for your sense of touch, and it functions in cooling. As you sweat, it helps you cool. It helps when you become cold. It senses that and helps you maintain your heat, and all sorts of other fun functions that aid you as a multicellular being. Now, your skin, being the largest organ in your body, is also home to a fair number of bacteria. Now, over here we have our gram-positive staphylococci. This makes up the greatest percentage of the species of bacteria that are living on your skin. Because they are halotolerant and they can resist the dry, salty environment of your skin, that's why they predominate. You do have a few gram-negatives, not very many though. Now, in addition to bacteria, you also have fungi, mainly yeasts. These are fungi that live in multicellular form most of their lives. Some of them are opportunistic pathogens like Candida albicans, some of which are mutualistic or commensal. They're not doing any harm. So those are the main microbiota of your skin. These are the organisms that are there normally, generally not causing a problem. But enough with the microbiota. Let's talk about those diseases of the skin that are caused by bacteria. We're going to talk about impetigo, toxic shock syndrome, and necrotizing fasciitis. There are other diseases in the book. Feel free to go over them, but these are the ones that I'm going to test you on. Impetigo is an extremely infectious infection of the skin that is common in children between the ages of about 2 and 5. They can spread it to their friends, but an awful lot of it is caused by self-inoculation. The organisms that cause this are primarily Staphylococcus aureus and, to a lesser degree, Streptococcus pyogenes. I'm going to refer to Staph aureus mainly for this disease. What happens is most of us have Staph aureus already on our skin. Then when it gets into a break in the skin of these young children, then it replicates, causes an immune response, and you get the signs and symptoms here. You get these blisters, these lesions that crust over. And this is caused by your immune system fighting the Staph aureus within the skin break. It's extremely itchy, and the kids often will scratch and auto-inoculate to a different part of the skin. There's also scalded skin syndrome. This is also caused mainly by Staph aureus, and this is where it produces some exotoxins, and these exotoxins cause a broader immune response. It's still localized. It's usually one part of the body, but you can see that we have an increased immune response. We have inflammation in this particular person of all of the fingers. They're swelling, there's redness, and these toxins cause the skin layers to separate and the top ones to peel off as if you'd been scalded with hot water, but it's coming from a microbial infection. Next up is toxic shock syndrome. Now if you look at this picture, it looks an awful lot like scalded skin syndrome. There's a reason for that. Basically, toxic shock syndrome is scalded skin syndrome all over the body instead of localized. Toxic shock syndrome was first characterized in the mid-80s when they first came out with superabsorbent tampons. Previous to this, you had to change the tampons on a regular basis, but when they came out with the superabsorbent tampons, they could be left in place for longer. And what happened is some of the normal microbiota of the skin replicated on the tampon. They were provided with lots of food, moisture, and they got into the areas where they shouldn't be. And we had a lot of primarily young girls and young women who were coming in expressing these symptoms, which were fever, this sunburn-like rash on the palms of the hands and the soles of the feet, vomiting, often followed by shock, and in some cases organ failure, especially the kidneys. What's happening is, because the organism is growing to higher numbers, then they cause more problems. Also, we've since found, some Staphylococcus aureus produce a toxin, toxic shock syndrome toxin 1, and it's the main thing that causes these symptoms. Nowadays, we generally don't see toxic shock syndrome with tampon use. What we generally see are from surgeries or from birth where you have packing with absorbent material. Kind of leads to the same problem. This is where you've had nasal surgery or if you've just given birth. But they try to keep an eye on this so that the packing is removed frequently enough that you don't get buildup of the biofilm, and hopefully you don't get the Staph aureus that produces the toxic shock syndrome toxin. Next up, necrotizing fasciitis, or also known as flesh-eating bacteria. Now there are only 15,000 cases of flesh-eating bacteria in the United States per year. Given the population of the United States, it's not that many, but they are all horrible. So that's why they hit the news. That's why we're all terrified of this disease. What happens is you have to have a combination of getting the wrong type of bacteria. It's generally a group A streptococcal species, or a gas, GAS, and having the genetics that leads to this. So it's a perfect storm kind of thing. What happens is the wrong kind of strep enters through breaks in the skin. Oftentimes the symptoms go unnoticed because it looks like a spider bite, looks like just a normal little scrape or cut, but it moves fast. And the organism produces toxins that destroy, as you can see in the picture, muscles, skin, you name it. And oftentimes, like in this case, they have to do a severe debridement, removal of the infected tissue, or you end up with amputations because we can't stop the spread of the infection with either antibiotics, and your immune system takes. So enough of that. Let's move on to microbial diseases of the skin that are caused by viruses. We're going to talk about warts, variola, which is also known as smallpox, varicella zoster, which is chickenpox and shingles, HSV1, that can be cold sores, rubeola, which is measles, and rubella, which is German measles. First off, warts. Most people at some time in their lives have had a wart. And warts are benign, self-limiting tumors that are caused by papillomaviruses. What do I mean by benign, self-limiting? Benign means that they're not going to metastasize and spread to other parts of the body unless you're severely immunocompromised. Self-limiting means that, generally speaking, for most of us, within a year or so, they're going to clear up on their own as your immune system realizes they're there and attack. Now, they are also contagious and they spread from person to person fairly easy. Some of them are harder to get rid of, like the ones on the feet. For whatever reason, the type of papillomavirus that likes to infect your feet has a tendency to hang on for longer, and oftentimes they have to be removed surgically. Most of us don't want to wait until they go away on their own because they're ugly, and also we don't want to spread them. So we have various over-the-counter treatments for them, or you can go to a dermatologist and have them taken care of. Now, some warts have been known to cause cervical cancer, but we're going to talk about those types of papillomaviruses in the section on sexually transmitted diseases. Let's talk about variola or smallpox. Smallpox has been eradicated. There is concerns that it will be weaponized, which is why I bring it up. There's also historical significance with smallpox. Now, if you look at this, there's all sorts of skin diseases that cause blisters, and the way to tell the difference is by looking for what's different. For example, with impetigo, you have that yellowish, crusty, pussy-looking lesion. In smallpox, variola, you start out with fluid-filled blisters that look an awful lot like chickenpox or like a cold sore, but then they become pus-filled, and then it often leads to scarring. So on this person, oftentimes wherever you see a pock, this pus-filled lesion, you're going to get scarring. So if you read historical fictions and they talk about somebody being pockmarked, it meant that they had these smallpox scars on their face. Now, depending upon where you were and at what time period in history, smallpox could kill between 25% to 80% of the population. In Europe, because we'd been dealing with smallpox for many years, most of the people that were really susceptible to smallpox had already been killed off, and so the descendants of people who were a little more resistant were the ones that were around. So generally you had between 25 and 50% mortality in European and Asian areas. When we took smallpox over to the New World, then the mortality rate jumped up to 80% in some areas. It really wiped out the North American populations, along with all sorts of other fun diseases that we brought. Up until about the 70s, we were vaccinating routinely, but once we were able to eradicate smallpox from the wild, if you will, then it was considered not worth the risk of the side effects of the vaccine to continue vaccinating, except for on the coast they continued vaccinating for longer because you had a higher population and you had people moving in from areas that had had smallpox more recently. Nowadays, because of the worry about terrorists or some other groups getting a hold of smallpox and releasing it as a bioweapon, we have started increasing our production of the smallpox vaccine again so that we can have it ready in case there is something like that. Now on to chickenpox and shingles. Now, interestingly enough, varicella zoster, the virus that causes chickenpox and shingles, is not related to smallpox. Different families. But the disease, particularly in the chickenpox form, looks an awful lot alike. So what happens is, with chickenpox, you generally start out with these lesions, these fluid-filled lesions or blisters that start out on the trunk. Sometimes they can move to the face, usually do not spread to the arms and the legs. Extremely itchy. They can become pus-filled. They usually don't scar. Generally speaking, the only time that you get scarring from chickenpox is if, and it used to be back in the day, when the kid would pick at the lesions and wouldn't leave them alone, and you would get a secondary infection, usually with staphylococcus. The not so fun thing about herpes is once you've got it, you always have it. Kind of sounds like HIV, doesn't it? But this one, herpes viruses go and hide in cells, and we call this going into latency, whereas HIV is continually producing viruses. What happens is you get chickenpox. It's passed by respiratory means, respiratory droplets, generally not passed on by contact, but it can be. And then you get better, and the herpes virus, the varicella zoster virus, hangs out in your nerves of your trunk. Then, usually speaking with most of us, as we get older, our immune system drops, and varicella zoster says, it is time to come back. And they move down that nerve and cause new blisters. Okay, fluid-filled blisters that can become pus-filled. And because they're coming out of the nerves where they've been in latency, they can cause severe pain. Shingles can be extremely painful, and even after the lesions go away, some people have that neurological pain for long periods after that. It's best not to get shingles. Now, if you've had chickenpox, you cannot get chickenpox from somebody who has shingles. But if you haven't had, you can get chickenpox. We call chickenpox the first initial infection. Shingles is where it gets reactivated. Now, we have some excellent vaccines. We have one for chickenpox. So most of you have not had chickenpox as kids. You've had the vaccine, and so you need to keep that vaccine updated so that you don't get chickenpox as an adult. Not always, but oftentimes, if you get chickenpox as an adult, you have a more severe form of it. I have a friend that got it as a teenager. He had these blisters all down his throat. He didn't want to swallow. He became dehydrated, ended up in the hospital. We also have a vaccine for shingles. For those of us that are approaching 50 years old, they have a vaccine for you, even if you've had chickenpox naturally, that can prevent you from getting shingles. We basically give your immune system a booster to keep that virus suppressed. Now, a close relative of varicella zoster virus is herpes simplex. Now, herpes simplex comes in two types: herpes simplex 1, which we're going to talk about here, and herpes simplex 2, which we're going to talk about in the chapter on sexually transmitted diseases. Herpes simplex 1 causes cold sores. We have a tendency to get them, like you see in the picture, at the margin of the lip and the skin. It can spread to other parts of the skin around the mouth. You can get them anywhere else. By the way, if you get cold sores, do not pick at them and then rub your eye. Herpes simplex, HSV, generally does not become pus-filled. Generally they're fluid-filled. They heal up without scarring. The only problem with HSV1 is that it reactivates far more commonly than VZV, varicella zoster. So any little thing can cause a cold sore. We call them cold sores because if you get sick with another virus, that lowers your immune system because you're fighting something else, and the herpes takes the opportunity to come out and cause you more pain and suffering. For women, hormonal cycles can do it. Sunlight can trigger it in both sexes. Stress can trigger it, because when you get stressed, that lowers your immune system too. All of these things can cause herpes. Now, herpes prefers the mucosa at the edge of your lip. You can get them on the insides of your mouth, and if you get it into your eye on your cornea, it can cause blindness, which is why I say if you pick at it, do not rub your eyes. If you have a cold sore, don't touch it. Just don't touch it. Now let's talk about rubella or measles. We have a very good vaccine for this absolutely horrible disease. It's 95% effective. Unfortunately, we probably won't be able to eliminate it like we did smallpox because it is so infectious. They've found that between 3 to 6 viruses are enough to cause disease. Generally, you have a much higher infectious dose needed for other diseases. Passed by respiratory means, the initial symptoms are cold-like symptoms. You have coughing, runny nose, runny eyes. Oftentimes you'll get what are called Koplik spots within the mouth. These are red spots with a blue-white center that are seen opposite the molars. That'll show up before this rash shows up on the face, moves to the trunk and the limbs. It's generally not a fluid-filled blister like your herpes or your pox virus. Unfortunately, in areas where they do not have access to the vaccine. In children below the age of 5, 25% of them will die of measles. Because of this, the World Health Organization had a goal to reduce the incidence of measles in developing countries by 80% by 2010. Now, if they didn't meet that goal, they were pretty close to it. And we've done a very good job of reducing the incidence of measles, which I say is all to the good. Now, another reason that you want to reduce your incidence of measles is if you get measles. This is not getting the vaccine, but actually getting the disease. You're more likely to get a neurological disease called subacute sclerosing panencephalitis. Like the name sounds, it is an encephalitis. It is an inflammation of the brain that leads to severe neurological problems followed by death. Now, this has a tendency to show up 1 to 10 years after you get measles. It's a rare complication of measles. Usually shows up in men, can show up in women, but you don't want to risk it. So make sure you keep your measles vaccine up to date. Now for our last viral skin disease, rubella, German measles. Now, German measles has very similar symptoms to regular measles, but you've got much milder symptoms. Usually you have the rash for 1 to 3 days. You generally feel pretty good during the process. Generally don't have the cold-like symptoms beforehand. Rubella is mainly known for causing birth defects. If a woman gets rubella, German measles, when she is pregnant during the first trimester, it can cross the placenta and infect the baby. Now, the fetus does not have a developed immune system that can fight this virus, and you can have deafness show up, mental retardation, and death of the fetus come from this. So we've got a program of vaccination that has reduced the incidence of rubella, and we especially want to vaccinate women of childbearing age so that they don't get rubella while they're pregnant. Now, if you've had German measles, generally speaking, you only get it once and you don't have to worry about it. But why risk it? Now we're going to talk about fungal infections of the skin. First, we're going to talk about Tinea pedis, and then we're going to talk about thrush. Tinea pedis is a fancy term for athlete's foot. Basically, you get a fungus living in your epidermis. Basically, they eat those keratinized skin layers. They're one of the few organisms that can. But because you get an immune response, then you get the classic signs and symptoms of athlete's foot. You get a fluid-filled blister. Boy, an awful lot of these skin diseases cause fluid-filled blisters, don't they? But one of the differences with athlete's foot or jock itch or ringworm is that you get a red ring around the fluid-filled blister, and it's because fungi grow out from the initial infection site. And so the immune response is in the same way. You get inflammation around at the edges, you get the fluid-filled blister in the middle. Now, athlete's foot in most of us is annoying more than life-threatening. It itches because of the inflammation, it's uncomfortable, but very few of us have died of athlete's foot. Now, if you are immunocompromised, then it becomes a severe problem and it spreads to more of the body. Now, because it is highly uncomfortable and it's icky and it's highly infectious, spreads from person to person, we do have lots of over-the-counter medications for treating this. One of the best ways to keep from getting athlete's foot, public showers, swimming pools, you name it, is 1, wear flip-flops, don't come in contact with the spores, and 2, dry out the skin between your toes. If the skin between your toes stays moist, you're more likely to have a fungal infection. So either dry really well between your toes, or I've found taking a little isopropyl alcohol, rubbing them between your toes and the soles of your foot, dries it right out. You're less likely to get athlete's foot. Thrush is a yeast infection of the mouth. It's caused by Candida albicans. It's an opportunistic pathogen, and generally speaking, you see it in young children whose immune systems have not developed sufficiently to fight off this opportunistic pathogen. It's really icky, makes you smell yeasty, it's nasty, kind of uncomfortable for the poor little babies, but it generally clears up on its own. Now, if you get it as an adult, generally speaking, this is an indication that your immune system is suppressed. Generally, we only see thrush This isn't all the time, but generally speaking, you only see it in people who are progressing into AIDS. So it's a symptom of that. And as you can see, it looks like cottage cheese tongue. We have some oral fungicides that we can give. Because fungus are eukaryotes like we are, generally have a higher toxicity level to therapeutic effect, but we have some very good ones for this. Now let's finish up with microbial diseases of the eyes. We're not going to spend a whole lot of time on this. Generally speaking, if you get an infection of the eye, it's conjunctivitis. It's inflammation of the whites of the eye or the conjunctivae. We call this pink eye. Gee, I wonder why. Most pink eye is caused by viruses. There's not much you can do about it. It's highly infectious. Do not share towels with anybody who has pink eye. And if you have pink eye, do not touch stuff and then touch other things. It's spread by contact. Generally clears up on its own. Now we do have some bacterial conjunctivitis. Some of it comes from opportunistic infections of the sinuses. They move into the eyes from there, up the tear ducts. Also, it used to be that babies would get conjunctivitis from catching gonorrhea from their mothers as they moved through the birth canal, through the vagina, out into the world. So to prevent this, we would put silver nitrate drops into their eyes to kill off the gonorrhea so that they wouldn't get gonorrhea-associated conjunctivitis. This could lead to blindness. Nowadays, the main cause of blindness from conjunctivitis is caused by chlamydia. Pretty much we don't see it in this country anymore, but you can get chlamydia in the eyes, and it causes lesions under the eyelid. So every time the person would blink, those little bumps would lead to progressive scarring of the cornea and would lead to blindness. Now, this is one of the more preventable forms of blindness, and we have some good drugs for chlamydia of the eye. And what would happen is you get weepy anytime you get pink eye, and flies will come and drink the tears, go to the next person, land on their eyes, and pass it on. Mostly we see this in developing countries, but on a historical note, Annie Sullivan, who was the teacher of Helen Keller, eventually went blind from chlamydia conjunctivitis. So it's a good thing that we don't have this. Fly control can prevent this, and also using drugs to clear up chlamydial infections of the eye. Well, that's it for this chapter. Now you notice in the summary I have a whole lot more diseases than I want you to know, but the charts were too good to pass up. I didn't want to do them all myself. So make sure you know the symptoms of the disease, especially what makes each of them different. If you have a whole bunch of diseases that cause fluid-filled blisters, make sure you can tell the difference between those fluid-filled blisters. Also know the causes of the disease, and in brief, how we prevent the transmission, what the mode of transmission is, and how we treat these or prevent them if the main treatment is vaccine.